Let's understand the chapter inflammation. So first of all, what do you mean by inflammation? Like what is this inflammation? So let's understand first that whenever there is an infection or damage set in our body, the inflammation simply acts as a delivery boy, your Zomato or Swiggy, but that will deliver food. This will deliver host defense cell to damaged tissue or foreign body for eliminating them. As they are helping us to get rid from this infection and foreign bodies, this is very important for survival. It helps us to get rid from both the initial cause of injury, that is the bacteria or toxin, and also the final cause of injury, that is the damaged cell and tissue. If there is no inflammation, the infection will go unchecked. Wounds will never heal. What are the steps involved in this inflammatory reaction? R for response, R for 5R, you can learn it that way. So first R stands for recognition of the injurious agent, like where is injurious agent, etc. Second R for recruitment of leukocyte, that is like hiding them. Third R is removal of the injurious agent. Fourth R is for regulating or controlling the reaction and dominating them. And fifth R is resolution or repair of the damaged tissue. Let's understand this further. First, we will recognize that this is the offender that came in our body and we have to get rid of it. Then we will hire WBC for this job, that is recruitment. WBC will came out of the circulation and start fighting against these offenders and finally removing the agent. Regulation is also necessary so that these WBC do not start harming our own cells. Once our job is done, we will terminate the reaction and final repair of all the damage that is caused by the war between our immune system and the offender. Cause of all these fights and reaction in inflammation, we develop rubor, that is redness, calor, that is increase in temperature, dolor, that is pain, tumor, that is like swelling, and one additional, that is punctioliscia, that is loss in function. So you can learn like rubor, R for redness, calor, calorie increase in temperature, and dollar, money, money gives pain, and tumor like not that harmful one, but it's like a small swelling. And functioliscia is function loss. It's that simple. Why this inflammation is happening in our body? There's four main causes behind this. First is infection, that can be any like bacterial, viral, parasitic. Second is tissue necrosis, that is tissue death caused by any injury or trauma. Third is foreign body like dirt and suture. And fourth is our own immune response, like in many autoimmune diseases. We have mainly two type of inflammation. First is acute and then second is chronic. Acute inflammation is the initial rapid response to infection that starts in minutes or hours, while chronic inflammation starts later, after days, when acute inflammation is not able to eliminate the infection. Acute inflammation starts quickly and ends quickly, hence it is of short duration, while chronic inflammation is of longer duration. As acute inflammation is of short duration, it causes less tissue destruction, while chronic inflammation causes severe and progressive tissue destruction. Acute inflammation is the first response to infection, hence it involves innate immunity type reaction, while chronic inflammation develops later and is of longer duration, so it involves adaptive immunity type reaction. Local and systemic sign of acute inflammation is more prominent, while that of chronic inflammation is less prominent. Acute inflammation mainly involves your neutrophils, while chronic inflammation mainly involves macrophage or monocyte, lymphocyte, plasma cells. Hallmark of acute inflammation is increased vascular permeability, while of chronic inflammation is tissue destruction. Both of them you will study later.